Hi, welcome to the Mental Wellness Journey. I'm very excited today to have Dr. Morgan Camp with us. He's doing some interesting work, and it is perfect for this online video series. So thank you, first of all, for coming and bringing your experience and knowledge to share with everybody. Dr. Morgan Camp, MD, has 20 years of experience treating thousands of patients at his practice in Mill Valley, California, with a specialization in chronic illness reversal, and regenerative medicine. In addition to a strong background in chemistry from Vanderbilt University and mainstream medicine at Emory University and the University of California, San Francisco, he has learned the best aspects of functional medicine and herbology, and is now creating non-prescription treatment options to help people with mood-related disorders. He is passionate about helping to empower those who would like to learn to take care of themselves and to continually expand into ever-increasing states of well-being and ease. Far removed from the paternalistic doctors of the past, he is here to be your advisor, advocate, and source of inspiration, and to ultimately help you take care of yourself. So Dr. Camp, you are like so perfect for our series. I love what you do.
Thank you, Lauren. Thank you. Thanks for having me. Really, very happy to be here. Thank you.
I'm really curious how you define anxiety. Here I trained traditionally in psychiatry and have been dealing with anxiety, probably personally lifelong, but, easily since 1990 when I began training. But how do you define it, and how does that differ kind of from mainstream psychiatry?
Great question, Lori. And but before I jump into that, I'd like to give you a little outline or overview of what we're going to cover today, so all our listeners have an idea of the flow of our talk.
Okay.
We'll talk with some perspectives on anxiety, define it, how I define anxiety versus the mainstream, and then we'll dive into some of the hidden causes of anxiety, including vitamin deficiencies, hormonal imbalances, toxins, and a lot of other causes. And then I'd like to give our listeners some tips on how to get the best healthcare possible. And then we'll cover some herbal formulas that can help with anxiousness. And then if we have time, Lori, I'll give some of my 10 personal hacks that are also covered in my ebook, that is my free ebook that's out in the promotion, that I personally use that have helped me pretty much eliminate anxiety from my life over the last few years, because I've suffered from it quite a bit. Also, probably pretty much most of my life, and I never really even knew that I had it. I was in denial a lot. When we're in training, we hear the word anxiety. It's sort of I felt anyway that I was judging myself for thinking that I might even have anxiety. So it was great.
Yes.
So I was like, oh, I don't have anxiety. That's not me. I'm the doctor. The doctor's not anxious. We're supposed to be, we're in control. We're not supposed to be anxious. So it was quite a illuminating point in my life. And I realized that background noise and nervousness was anxiety, and that once accepting that, I could then look for good treatments for it. So what is anxiety? So
how do you define it? Right, exactly. Because everybody always still asks me, well, what is anxiety? And it's a little bit different for everybody.
It absolutely is. And it's caused by so many different things also.
Mm-hmm.
So I define it, I like to just talk about, break it down into mental and physical aspects. So mentally, and just look up the definition of anxiety. We associate words like worry, concern, nervousness, tension, anything that's like makes you feel. One way to look at it, and I've worked with a lot of different healers all over the world, is a lot of native traditions talk about anxiety is like anything that makes you feel like contracted, like expanded and open. So that's one easy way. So if you feel, so when I feel tense and contracted, that I'm starting to be aware that I'm anxious. And on the physical level, it can be tension, headaches, shortness of breath, palpitations, just feeling a little uncomfortable in my skin. And that can also go up to like dizziness, lightheadedness, disorientation, shaking, trembling. And I'll talk about how that relates to our nervous system in a few minutes also.
Yeah, the subtitle of the series is Honor the Authentic You. And a lot of times I see people who aren't comfortable in their own skin. And I feel like that keeps them away from their authentic internal selves. And, anxiety seems to fill the void sometimes. And that's why I think it's wonderful that you're talking about it. And in addition, it's so prevalent. But what are some of root causes of anxiety?
Well, first, I'd like to comment on what you just brought up, Lori. Yeah, honoring the authentic self, and I'll go over this in a second as one of the causes of anxiety. But I read a quote recently that that anxiety is just us. It's just us being shown the cracks in our awareness of reality, meaning that we're getting feedback from the world that the way we're viewing our reality and world is a little off.
Mm-hmm.
And what that means to me is that we're not in our authentic self, we're in our illusory self, we could say. And so that gives us an opportunity to dig deeper and find out, okay, what's that separation between who I think I am and who I really am.
Right.
And for many people, what's leading to those symptoms, so in the mainstream model, first I'll go over that for a second, Lori. So the mainstream model, right, which you and I are both familiar with because that's what we were trained with, is that there are neurotransmitter imbalances causing anxiety and or depression and other mood disorders such as GABA and serotonin deficiencies or excesses of one or the other, or imbalances of one or the other. So most of the pharmaceutical treatments that you and I have learned through our medical training are based on, treating those neurotransmitters. There's certain classes that treat the GABA system and certain treat the serotonin system and dopamine system, etc. But that is not that those can't help certain people, and they certainly can be life-saving, but at the same time, why are the neurotransmitters out of balance, and how can we work to bring those back to balance in a holistic way?
Yes.
Right. So that's how I look at health, medicine, and anxiety more in a holistic way. So what's that underlying issue that's leading that imbalances? And the true story, and here's one of the real issues with mainstream medicine, is that there's no one cause, right? There are a myriad of causes for anxiety. Every person is different. So part of my passion is to help teach people what all those differences are so that you can, out of the whole toolbox, learn which of the tools are appropriate for each of us.
Okay.
So for many people, anxiety is a symptom of chronic maladaptive stress. So, we all have acute stressors in our world, and especially right now, there's quite a few of them.
More than we're used to. I haven't seen it like this, in all honesty. Just
right.
COVID and
right. And as as those external fears or external stressors, when we take them on and internalize them and carry them around with us every day in the forms of worry and nervousness and fear, then we internalize that stress and it becomes chronic. And as we do that, we become more nervous. We notice we might have more sweaty palms, palpitations, heart racing, etc. And interestingly enough, these are many of the same symptoms that we get when we release the hormone adrenaline, right? So we're in that fight or flight response, we release the hormone adrenaline, and that mimics many of the symptoms, interestingly enough, of anxiety. So I having worked with patients for 2 decades here in Northern California, I've noticed many causes of anxiety are simply related to this excessive adrenaline buildup in the system. And we'll talk more as we go through the talk on how to detoxify adrenaline and how to remove that out of our system. And then what happens when they're in that hyperadrenergic state or adrenaline state, we become more what's called sympathetic dominant. So sympathetic dominant is that fight or flight response versus the heal, sleep, rest, digest response, which is called the parasympathetic response. So anxiety is mostly associated with that sympathetic response. and relaxation, the parasympathetic response. So whatever we do for anxiety, we want to bring that back to balance. So no matter what illness we have, disease we have, etc., the key is always the same. More parasympathetic equals better healing, better sleeping, less anxiety, better sense of well-being.
Yeah. And what about, are there any other cultural perspectives on anxiety? Like one thing I'm familiar with is Ayurvedic. I'm not as familiar with it, I'd like to be, is Ayurvedic medicine.
Yeah, I studied Ayurvedic medicine in med school.
Oh, wow.
Yeah, and the correlation, a lot of people who have chronic anxiety and anxious related disorders have what's called a vata imbalance in Ayurveda. So vata, in Ayurveda, they have three principal energies that are in balance in all of us, or in imbalance in all of us, and those are what's called vata, which is the wind energy. There's also energy called kapha, and there's an energy called pitta. But we'll focus more on the vata energy, which is that wind energy. So, this can be a quite easy concept to understand. For example, what happens if you drink 3 to 5 cups of coffee? Have you ever done that?
I've never done that at all. Never. I learned to drink coffee in med school, unfortunately.
Right. And, when I was in residency, we'd drink 3 to 5 cups of coffee. After being tired, I might get dizzy. My heart would start racing. I would still be tired, couldn't think clearly, sort of just being ungrounded. And that's that wind energy, because coffee has a lot of that vata energy. Why is this important? This is important because we can learn to change our diet if we have a lot of that vata energy to foods that have less vata, and we can learn that there are certain herbs, and we'll talk about those in a bit, also that will actually help lower and balance the vata energy too. And as a consequence, we lower many of the symptoms of anxiety. It's a very simple and easy to grasp concept when we break it down. And that's one of the things I like to do. I like to take the complex and break it down to simple, easy to understand concepts.
Yeah, no, I think it's helping me. And I like the way that you focused kind of first on, the physical, and now we're going into the different cultures and the emotional. And then when it gets more, I want to say philosophical or religious or spiritual too, which is
exactly
that there's one doctor that's kind of covering it all.
Well, this is like a history of my journey, so to speak. So I've had so much anxiety, and I've have all these things myself. So I've learned them all just as my personal journey. So it's all personal experience here, Lori.
Well, but also I think I'm sure speaking with you, working with your clients, and working with them if they've had anxiety. Maybe it's through your prism, but I'm sure you've been very helpful to lots of different people. So like more from an emotional standpoint.
Right. So yeah, from an emotional standpoint, a lot of anxiety is related to fears. And right now we're all faced due to COVID with a lot of fear, and especially fears related to survival, our role in the world, how we're going to get our basic necessities like food and shelter. And this is just ramping up more and more and more right now as COVID and our, the media's portrayal of COVID, which is just amping the fear up more and more because the media preys and feeds off our fear, right? And amps it up, and that's how they get more coverage. As that's amped up, any fear we have within us is resonating with that fear of the collective, and it's just like turning our fear up on a volume knob. And it's critical during this time, more so than ever, that we learn how to work with that fear. And I talk a lot about this in my ebook on how to work with this, and we'll talk about that at the end. Some very simple practices that I've been taught, traveling the world, working with all kinds of healers, gurus, shamans, and energetic healers who help guide me through a lot of this. So happy to offer some of that for our listeners today.
Yeah, I'm very interested in that too. So, but let's start back at, more you go from the traditional, And you, it sounds like very early became functional medicine and alternative medicine. So what are some of other non-traditional medical causes of anxiety from like a functional medicine doctor's perspective?
Okay, great. Yeah, this is a good list, and these are what I specialized a lot, or I have specialized a lot in my practice. And again, interestingly enough, I mean, I've had the archetype of the wounded healer, you could say, from the Jungian archetype, and so I've experienced actually all of these myself. Again, so again, I talk from personal experience, which I like to tell that to people so that they have, they understand that. I think it's wise if you have a doctor who's gone through something similar to what you have, you often will find that they're more empathetic. I'm certainly more empathetic now, having gone through this, than I was before I suffered through these. So quite a few of these, Lori. Top of the list are infections. So chronic viral infections and spirochete related infections such as Lyme disease. The viruses that are most common out there that cause these types of neurological symptoms include Epstein-Barr virus, varicella virus, which is what underlies chickenpox. The Epstein-Barr virus is what causes mono typically earlier in life, but it can persist and cause things like chronic fatigue, chronic anxiety later in life. Chronic herpes infections are also related to this, and those are Epstein-Barr virus and varicella are herpes-related viruses. The next group are toxins. Mold is actually an epidemic of problems in our country. So when mold grows indoors, it releases neurotoxins that are stored in our brain and cause chronic neurological inflammation, of which anxiety, insomnia, and depression are major symptoms. Dr. Shoemaker is one of the mentors I studied with on mold toxins, and he's written quite a few books on the subject if any of your listeners would like resources on that. Now, I'll give you more resources as we go through the talk on other topics as well. Other toxin-related organisms including Lyme disease, candida, and heavy metals. Another source of toxins are actually poor dental hygiene, including cavitations and root canals. So cavitations are areas where you get like chronic wounds growing underneath a root canal that produces like a toxin release chronically into our nervous system and into our brain.
Right. And people might not realize it. You think it's in your mouth and you would know it was there, but a lot of times you don't.
Yeah, I didn't. I mean, I had no idea I had that. I literally had to convince my surgeon to do it. He wasn't convinced by the CT scan, but I'll never forget how the nurse gasped because it smelled so bad when they actually opened up my wound.
Great.
Yeah, exactly. Just what you want when you're in operation, have the nurse gasp. But it was, once that was cleared, I had a rapid healing from that.
Okay, great.
Yeah, so other causes of which, one of my main specialties are hormones, so a lot of hormonal disorders, which we'll talk about in greater depth here soon. Intestinal disorders, including leaky gut, irritable bowel syndrome, dysbiosis. Poor nutrition leading to vitamin and nutrient deficiencies, which is a huge problem right now as our soil and vegetables are depleted of nutrients.
Yeah, and people, I think in the U.S., I know this is international, but specifically in the U.S., we're overfed and undernourished. It's an epidemic.
Absolutely. It's calorie-rich food that's deprived of vitamins and nutrients. Absolutely, Laurie. And then there's genetic defects around the metabolism of folic acid, glutathione, homocysteine, as well as the detoxification of adrenaline and adrenaline metabolites. And so, and I'll go over this in a bit. We can find good functional medicine doctors who can help you test for all of these. That's what I recommend for our listeners.
Mm-hmm.
And then on the more energetic level, there's things like unresolved traumas, post-traumatic stress disorder. Then there's things that we don't talk about too much, like ancestral traumas, but those are coming more and more to the awareness of the world right now.
Tell me what you think of, when you say ancestral trauma, I'm pretty sure I understand, but just, I don't want to make assumptions.
there is like, for example, there's a study showing that the survivors of Holocaust, the children of Holocaust survivors have in their genetic code the stored traumas. So there are studies on that. So we actually, so in epigenetics, we learn that, we store actually traumas that are passed down through our family lines. So a lot of traditional healers work to help you unravel those. And that's a huge, broad topic. I just mentioned it so it's to
Right.
bring to more awareness. And I think epigenetics will show more and more of this through the future, and this will be something that we all become more aware of. For example, through like the Black Lives Matter movement now, we could look at that as an ancestral trauma and a community trauma as well, right?
Absolutely, absolutely.
Yeah.
So as I take you off on a side course, what about, can you be a little bit more specific about, the vitamins and mineral and hormonal deficiencies or imbalances maybe?
Yeah, absolutely. Some of these are quite easy and, quite easy to treat and easy to test for. So I like to just mention the basics to people. Because I learn out there on Google right now, it's really hard to find good information. It's gotten so much harder than it was 5-10 years ago for me. There are active misinformation campaigns now that are being funded by people that don't want this information out there. I'm convinced of it. And there's active censorship against this information.
That is very clear, which is extremely frightening.
It is, right? So, and I've learned this, I'm a scientist, I've studied chemistry, then medicine. So I look at this from a very logical perspective.
Right.
From the vitamin perspective, it's easy. Most of us all need more B12, and the form I prefer usually is methyl B12 or methylcobalamin. A lot of us need more folic acid, and the best form of that is methylfolate. Methylfolate is actually it is a prescription. That's how I first learned about it.
Mm-hmm.
It is available by prescription at high dose. It's also available over the counter.
Mm-hmm.
Magnesium is one of the biggest deficiencies. I test red blood cell magnesium levels on all of my patients for the last 10-15 years. And even here in Northern California, where everybody's eating the best organic foods in the country, almost everyone is deficient. And so it's critical that we all get adequate magnesium. I'm a gardener too. If my plants don't get magnesium, they turn yellow and wilt and don't look very good. And when we don't get magnesium, we get tired, we get anxious, we don't sleep good, we get muscle cramps, etc. Magnesium fuels over 300 enzymes in our body. So when we don't have it, a lot of things go off. And it's really important that you get the right form of all of these. So like magnesium citrate or magnesium oxide are common, inexpensive form of magnesiums that don't work that well. They work good for constipation, but they don't work good for getting magnesium into our brain and nervous system. You need forms like magnesium glycinate, threonate, malate, etc. for that.
Mm-hmm.
Glutathione is one of our major antioxidants. When we don't have glutathione, we get a buildup of chemicals and heavy metals in our brain and nervous system that lead to anxiety.
Mm-hmm.
Omega-3 fatty acids like EPA and DHA are critical for calming inflammation in our brain, which is leading to anxiety. Pregnenolone is the precursor hormone for making our stress hormones cortisol, and it's also a main anti-inflammatory for our brain and for our memory. So I've prescribed pregnenolone maybe more than any other treatment or supplement over the last 20 years.
Oh, wow. Okay.
Yeah, it works so good, but it needs to be in a liquid form to get the best results. So I really prefer the sublingual liquid forms of pregnenolone.
Okay. To get levels to change in the body?
Yeah, that's one, I don't pay attention to levels of pregnenolone at all.
Oh, okay.
I use it as a support mechanism, especially in the liquid sublingual form for patients that have a low cortisol in their salivary cortisol testing. Because pregnenolone, when you give it in the liquid form, is directly convertible into cortisol.
Okay.
Yeah,
That's
and progesterone. So I find a lot of women in the premenstrual, perimenopausal age range who are low in cortisol that find that pregnenolone really helps just mellow them out, give them a little more neurological function for improved memory and improved focus.
I,
It works really well.
I see a rush to pregnenolone now because
Yeah.
I don't hear that very consistently. So it's a very interesting perspective.
Yeah, in the oral form, I don't find it that effective at all. But in the liquid form, I learned from one of my friends and mentors, Dr. Dan Kalish, taught me about pregnenolone, and I've used it ever since then with good results. Yeah. Another B vitamin called niacinamide can be very useful for treating anxiety. There are a lot of psychiatrists who use niacinamide at very high doses in the 60s and 70s.
Mhm.
They even had reversals of patients with schizophrenia and very severe forms of nervous system disorders. Because what happens is if you take niacinamide at the high enough dose for long enough, and some people will need to take it for a long period of time, it actually will eventually detoxify all those adrenaline and adrenaline metabolites that are leading to many of the symptoms of anxiety and neurological dysfunction. Yes, so that's a brief overview of a few new
Yeah, but there's
vitamins.
some definitely pearls in there that I don't see on average lists that I agree with you, probably don't use as much, but I love that you're very detailed on that. What about hormones? I mean, you touched upon cortisol and progesterone, but thyroid is like huge in my, well, maybe it's not huge. It's the first thing I learned about, so therefore it was huge. So,
Yeah, no, in my experience, thyroid disease is the most common hormonal disorder in our country, and the one that takes the longest to diagnose for most doctors. So most patients go years between feeling they have problems and they just don't know what it is until they actually get diagnosed and treated appropriately. So thyroid hormone is the master hormone. It's needed for neurological health. And if we really want to look at one hormone that's super critical for neurotransmitter health, I think it's thyroid, the thyroid hormone. I really recommend that anyone who thinks they have thyroid disease read a book called Stop the Thyroid Madness. That's written by a nurse. I can't remember her name right now, but it's a bestseller, easy to find. And it talks about all the principles of thyroid disease and all the problems related with it from mainstream medicine, including doctors not ordering the right test, doctors not listening to their patients, doctors not using the right dose of medication. I could talk for hours just on this one subject. I've been treating thyroid disease since I got out of residency. And I was lucky enough to have so many patients who came in and who educated me on many of the subjects of which I'm now quite knowledgeable, just because I had to keep up with them. They kept me on my toes.
California people, yeah, they are challenging, but like wonderful because they want somebody to, accompany them on the journey of healing, which is wonderful. You were
Exactly.
open, but you were totally open. So I think thyroid is one of those areas that's very easily to see the difference between conventional medicine and alternative medicine. So how would you suggest people find doctors that can help with anxiety and research the hidden causes?
Well, first off, the key is for us. I recommend for all our listeners, and I think we've already got that crowd listening are people that want to educate themselves. People that want to be their own resource and learn their own knowledge base, so that they can make sure their doctor is actually knows what they're talking about. For too long, we've trusted doctors, we've trusted the pharmaceutical industry, we trusted the FDA. We've trusted all these industries to look after our well-being, and now I encourage us all to look deeper and see that there are way too many ties between the FDA and the pharmaceutical industry and basic scientific research, there's too many conflicts of interest simply enough to be able for any of us to trust other people for our most important thing, which is our health. So for me, I just like to encourage everybody out there to find a doctor that you can trust. Find somebody that's empathetic, somebody who's patient, understanding. And as I mentioned earlier, it can be nice if you find a doctor who has had some of the symptoms that you have or have had, or maybe they've healed them now, and because they've actually learned from it and they can empathize more with you and your process and where you are. One of the things I was taught in med school, which I don't think is happening much anymore, is that doctors should actually listen to their patients. They should listen. I was taught that the history and physical exam by my great professors at Emory University, that 90% of the diagnosis should come from history and physical exam. And now when I'm reviewing cases with patients, they're like, well, my doctor here, he ordered this lab and said I didn't have something, or he ordered the lab and said I was normal, or he ordered the lab and said I didn't have this. That's not history and physical exam. That's a lab test. And lab tests have so many strengths and weaknesses, and it's important that we learn what those mean. For example, go back to the thyroid test earlier, when we talked about thyroid disease, Lori, the normal range for thyroid disease is so large that just because something is normal doesn't mean it's optimal. It doesn't mean it's ideal. It doesn't mean it's where you are functioning at your best and where you will be your healthiest. I studied thyroid disease a lot with Dr. Terry Hertog, who is a Belgian endocrinologist. And, he showed me so many studies showing that, if you're on the very low end of this thyroid test, you're at higher risk for diabetes, you're at higher risk for heart disease, you're at higher risk for dying of all causes. And if you're over here at this end of the spectrum, all of those go away. And yet they're both within what our mainstream calls normal. So do you want to be normal and barely alive, or do you want to be optimal? And so I work a lot with people that want to be optimal, and I'm sure most of our listeners want to be optimal. And to be optimal means we have to educate ourselves, we have to be advocates for ourselves and our friends and family members, and we have to ask a lot of questions. It doesn't mean we're combative at the doctor's office, right? We have to we have to learn how to be, we have to learn how to have these difficult conversations. And we also have to learn how to not tolerate bad care. I'm a big advocate for changing our medical system. And changing our medical system in one way is very simple. Don't give your time, energy, money, or your well-being over to somebody who does not have your best interest at mind and at heart. So I really encourage people to find those doctors that are really want to help them and are committed to learning. Being a doctor is there's a lot to learn in our world, and doctors who are committed to educating themselves and staying educated and going to conferences and reading books and listening to patients and being willing to learn from their patients is so critical, Lori. I will never forget in medical school, one of my last days of medical school, actually before I went to Nepal, where I lived in a monastery for 4 months. One of my most disheartening days of medical school was when I was working with the chief of neurology. And a family had driven 5 hours to present their story. They were a very difficult case. And I don't remember the details of the case now, but as the med student, we go in, we talk to the family, and then the family tells us the story, and then we present it to the chief doctor. And the chief doctor was probably 70. He'd been doing this forever. Well established. I thought this guy was like the expert in the world, right? And I take the story from the family. I go out and I talk to the doctor and I present the story to him. And I'm like, oh, this is really interesting. I can't wait till we figure out what's going on with this family. He looks at me and he goes, how do people make this up? Where do they get these stories from? It was quite disheartening to me to realize that, that's actually how a lot of doctors think. It's like when we have a version of reality called mainstream medicine that puts everybody in boxes and labels them. And if a patient's story doesn't fit in those boxes, we say the patient's got a problem.
Blame the patient. Yep.
Right. And when I saw that, that was like a fork and I was like, well, I think I'm going to side with the patient story here. And I'm going to use my patients and my patient stories to guide me to learn more to help them.
Right.
And, if this version of medicine that I've been taught here at this, you know, well-established medical school where I just paid hundreds of thousands of dollars, that doesn't help me help them, then you know what? Maybe I'm just going to let some of that go or reconsider some of those hypotheses and see if I can come up with some better solutions out there. So I encourage all of your listeners to find doctors who are committed to that. There are a lot of good doctors now in the Institute for Functional Medicine and other organizations that are training and learning a lot. So I encourage you to seek them out and find them.
Yes, I'm a big supporter of IFM, but ifm.org. And it's people that are open to seeing the bigger picture, and they're committed to learning, which is great, which is so disillusioning, but exciting when physicians do step outside of mainstream. So this is an area that I have started becoming more interested in learning about herbal formulations and formulas. So how can herbs help with anxiety? And I know we had talked about before we started the recording is to talk about what you've put together called Be Serene, which I'm really intrigued by.
Yeah, thanks, Lori. So yeah, so while I'm working with patients to identify the root causes and to help them do everything, they're still suffering with anxiety, right? So you need something. And what I've learned is it's a lot easier. What I like to do when I'm treating people is give long-term solutions while giving short-term solutions.
Mm-hmm.
Because if we're just focused on, hey, fixing that root cause, but it takes a few years to quote, no, we'll probably go out of business very soon, right? I learned, and at the same time, if we're just giving out short-term solutions without long-term problems, then or without long-term solutions, then how are we really helping? So I like to combine those two. So yeah, so I used a lot of herbs in my practice to help patients with anxiety and insomnia-related disorders, and I studied a lot of herbs, and I used to use a lot of ashwagandha in my practice. I like that herb. It's an Indian herb. It's quite useful. It is a little on the warming side. So for some people, it's a little too warming. So a few years ago, Lori, I was stressed out. I suffered from neurological Lyme disease,
Oh, wow.
mold toxicity, nearly killed me. Three rounds of that. Plus a myriad of other things, which I won't bore you guys with. But during that time, I was so anxious that, I didn't want to go to work. I didn't want to go shopping. I couldn't go out to the market. I just had a lot of social anxiety, a lot of just background tension related to anything and everything. And so then I decided I closed my practice for a period of time. I took a sabbatical. And during that sabbatical, I actually went to the Amazon, where I'd always wanted to go since I was a child. And there I got a chance to study more of the plants of the Amazon. And there, interestingly enough, I was exposed to a tree called Malungu tree. And this Malungu tree has we use the bark of this Malungu tree in this product, Be Serene. And the Malungu tree is very powerful in that it's a very grounding tree, right? So that's like the opposite of the Vata wind energy we're talking about, which brings your energy up. The grounding energy of this tree brings you way down. There's studies on it suggesting, that it works similarly to Valium in the brain, without the addictive qualities and without some of the other qualities. So it actually has quite a few, amazing potentials. If we look at the product overall, Be Serene, which we created, it has 5 adaptogens. With adaptogens are these master plants that work on our ability to resist the damaging effects of stress. And these adaptogens also promote our normal physiological functioning. So they help us with this chronic stress that leads to anxiety that we discussed at the beginning. So
nature and herbs, I mean, they're just amazing because it's so clear that the universe is so much smarter than people, basically. And I think, traditional medicine gets carried away with itself and, created these wonderful antibiotics and different things, but still nature is smarter, I think.
Absolutely. When I was suffering from Lyme, I started learning a lot from a Dr. Stephen Buhner. He's an acupuncturist who's written a lot on herbs, and and he talks a lot about this innate intelligence of plants and how in every region of the world he has found that there are local cures for Lyme disease just in the local wildlife. If you can learn to find them and how to use them, and that's what he teaches in his book. So and I used his herbs a lot, had great results with him. And so then I started pondering this idea more. Okay, what other plants are out there that are not being used now? And luckily, I met all these indigenous healers in Peru, and they had worked with all these plants. And so they brought several of them to my attention. And so we created this formula, Be Serene, because I saw in my practice that the treatments that were lacking were those around anxiety and insomnia and depression, basically mood disorder treatments. From a holistic perspective, there aren't many on the market that work really well. There are some that have some short-term effect, but none that work really well. So I set out on a mission to create the best products I could find in the world and create new products that no one had ever done before. So we created a product that, again, has these 5 adaptogens, and they work by calming the GABA receptor, and they stimulate what's called acetylcholine, which is a neurotransmitter.
Mm-hmm.
Very important for our parasympathetic nervous system. And then they activate also the nicotinic receptors. And this is important because studies show that several of the ingredients, if we look at studies on the ingredients in Be Serene, they've been studied a lot for addiction. So we've had patients with addictions to nicotine, certain benzodiazepines, and other medications and drugs who've actually been able to get off of them they took the Be Serene a few months, and they just slowly weaned off of their off of the substance they were addicted to. And it was quite amazing. And most of that was unsolicited feedback. People just told us it naturally happened. In several cases, people just said that they forgot to take their whatever they were addicted to.
So they must not have been too anxious if they forgot.
The cravings just went away, actually, which is quite amazing.
Yes. And so the Malungo tree is the main ingredient, or you said there were some other ingredients as well?
Yeah, it's the unique ingredient in that it's not in any other product on the market now.
Oh, okay.
But we also have 4 other herbs in there. The Malungo is only in a small amount, because if you take one side effect of Malungo is if you take too much, it actually will lower your blood pressure, which for a lot of people can actually be good.
Mm-hmm.
So we decided just to we have just a little bit of Malungo in there. Then we have 4 other plants in there to modulate those. And those other 4 have been used traditionally for thousands of years. So 2 of those come from India, and that's holy basil and shatavari. And then 2 come from China, and they're schizandra and Romania root.
Okay.
And both of those, so basil is so revered in India, they call it holy basil. And there are a lot of studies on basil as an adaptogen. It does things like increase our levels of dopamine. It boosts acetylcholine. It helps reduce when we have cortisol spikes going up and down. It helps reduce those and stabilize those spikes. And it's a potent anti-inflammatory and antioxidant.
Yeah. Again, I'm just thinking a little bit more philosophically. Here we take our Western knowledge and Western science and apply it to what nature knows better than we do. So it's wonderful. I am actually looking very forward to trying it.
We look very much forward to your feedback back. And and for any of our listeners who want to try Be Serene, we're going to offer a promo, which will be in the links attached to the video as well as the offer of our free ebook. I mean, we've had such good feedback. We really have. I've been surprised at how well it's been received. I personally I always try everything myself for a long period of time, including B-Serene and Malungu and all of the other herbs and products I've mentioned. I always try them on myself first, to get to know the product, get to know the plant, and to get to know any potential side effects, etc. Yeah.
And I know we're running out of a little bit out of time, but you teased us with some things that you do daily to calm your own anxiety.
Oh yeah, absolutely. Yeah, let's finish with that, Lori. Yeah, and these are covered in the ebook, and there's quite a few other little tips in the ebook too. So we'll just go over these briefly. So first off, so we'll go over the 10 hacks for acute anxiety and stress that I use daily. So most importantly, when I feel anxious, the first thing that I want to do, and this is find a quiet, safe place without electronics, turning phones off and beeps and noises off, somewhere we just let our nervous system calm down. In a perfect world, that place would have some green around, like grass or trees, somewhere we can just get away for even just a few minutes. When I was working in my office, I would just go out, out the back door and, just stand in the grass for a few minutes, or find a quiet break room.
Mm-hmm.
The second thing I do, which I've gotten a lot of good feedback on, because I've been teaching this to a lot of people lately, is called box breathing. So box breathing is really simple, Lori, in that it is, it's a method where it's called a box because we inhale for 4 to 5 seconds, we hold the inhale for 4 to 5 seconds, we exhale for 4 to 5 seconds, and then we hold the exhale for 4 to 5 seconds. If we do that for 2 minutes, it is a direct hack to calm down that sympathetic nervous system and engage the parasympathetic. The nice thing about it is it's not some extreme breathing technique. So you can do it when you're in line at the store. You can do it when you're on the phone. You can do it any time, and no one knows you're doing it.
Nobody's, yeah.
I think it's one of those direct.
There are no lines anymore in the stores.
Yeah, exactly. Right.
Sorry. But right, when you're at the red light.
Exactly. Now the box breathing is so powerful. I always like to mention it's what they teach the Navy SEALs. It's what they teach snipers to do, so that the trigger finger is as calm as possible. So it really just helps calm that nervous system way down, so that we can be.
I actually didn't know that, but that's pretty impressive.
Yeah, it worked quickly. 2 minutes of that, and you're just had a patient yesterday tell me how much he's using that and loving that. I also like to work with technology whenever it's useful. A lot of technology I find is not useful, but one that I do find that's extremely useful is called the Inner Balance app from HeartMath. The HeartMath Institute is an institute here in Northern California that has done 30 years of research showing how, basically proving that if we learn to just work with our nervous system via breath work and meditation, that we can actually change our nervous system into this parasympathetic state. And in their app, they have a color-coded regimen of red, yellow, or green, showing you actually, based on how your heart rate variability is going, on whether you're getting into that relaxed parasympathetic state or that sympathetic adrenaline anxious state. For any people out there who are really struggling with anxiety and want an amazing feedback to show you when you're able to get into that parasympathetic state, there's nothing better than the HeartMath Inner Balance app. Yeah, really useful.
I found a lot of people that are type A that I just can't get them to take that step to do meditation. This is a great step because it is really valuable, and it gives you that instantaneous feedback. And type A people like to know they're doing things correctly. So
exactly, Lori. And
including myself.
Yeah, exactly. I meditated for a decade before I got this app, or I had it before the app, and I put it on and I was like, oh, this thing's broken. Like it says, I know how to meditate. I lived in a monastery in Nepal, and I realized it now that I wasn't getting into that good parasympathetic state. So it's so useful. Using their app shows it. They are now in Stanford and Kaiser here in California.
Oh, okay. Yeah, they
So
have great.
they are proven to help improve morbidity and mortality for hospitalized patients.
Yeah,
Um,
got great research.
right, great research. The hippie in me likes grounding practices. So I read this book a few years ago called "To Be Healed by the Earth," and
Okay.
it has a most amazing story of a psychotherapist who saved his life by learning to connect with the healing energies of the earth. And now he teaches it in New Mexico, and it's so easy. The simple explanation is that we can do grounding practices just by going outside and contacting the earth, either with bare feet or with some skin of some sort touching the earth. We can also touch a tree, and in doing so, we're actually connecting with the grounding energy of the earth, and it's helping bring that energy down again in their body. And through doing that, we're able to calm all the disturbances that are often leading to anxious.
20 years ago, I would have, no offense, please, intended, you were crazy. But then I found myself, liking to walk barefoot. And then I discovered that there's this whole theory, and I was like, oh, shoot, okay. So when you, automatically do something or drawn to do something, listen to that inner guidance again, and it's, yeah, proven. So
Absolutely. There's a good, have you seen that movie? I think the movie's called Earthing. Have you seen that, Lori?
no, I haven't.
It talks about how it talks about the science behind grounding and walking barefoot, and how the introduction of rubber soled shoes also correlates with a lot of our modern health problems.
Interesting. No, I have to check it out.
Because in our energy field, which we can't see and therefore don't think is real, many people don't, but in our
Right.
energy field, it's actually, it's electrical energy and frequencies. And just like we need grounding for our appliances in our home, we actually need grounding for our electrical circuitry also. So if you look at it from the electrical standpoint, it actually makes a lot of sense.
Yeah, exactly.
And then just a few more. You can make go through this quickly.
Yeah.
A huge component, one of my foundations of health, and you can see I've been drinking during the show here, is a large glass of clean, pure water. It's filtered by a good filtration system that removes chemicals, bacteria, and fluoride. A lot of research showing fluoride is not good for you.
That's an understatement.
Right. I also take 2 B Serene capsules. B Serene's best taken between like 1 and 7 p.m. If I have extreme anxiety, I'll take two twice during that time.
Why is it best during that time? That's interesting too.
Very good question. That's because if we go back to Ayurveda, they say that there are the 3 energies, the Vata, Pitta, Kapha, are actually naturally highest at certain times of the day, and 2 to 6 p.m. is the high Vata time. So that's why also the long line at the coffee shop, all these issues happen around then. It's because we're related to the Vata energy. We recommend taking it during that time as a natural time to bring into balance that Vata energy, which is naturally imbalanced at that time. And when people have insomnia, we recommend them taking during that time, because a lot of the insomnia is due to the Vata disturbance. So you'll take it during the day and actually sleep better at night.
Nice. Okay, good. I literally, as I spoke with you, I wanted to try it before we spoke, but with all COVID and the post office, it didn't get to me until yesterday. So I thought that was a good sign, but I'm looking forward, because I've been having problems falling asleep. So how many? So we have 6 so far of your 10 hacks.
Just a few more. One of my other simple practices is, this counterbalances the fear we're all facing now. So rather than focusing on lack and what we don't have right now, I've learned to focus on what I can be grateful for. So it's a simple gratitude practice. And just, very simple. I've learned this from different mentors, just focusing on the little things. Like, I'm very grateful I have a nice telephone where I can communicate to my friends and family and patients. I have a nice computer. I have nice health right now. I have clean water to drink. I have good oxygen to breathe, and we can expand from there. But what that does is that just shifts our nervous system. It shifts us into a more heart-centered space. And again, when we're expanded and open in our heart, guess what? We're not contracted and anxious like we talked about at the beginning. So just anything we can do to open this will counterbalance this. That simple. In the evening, if I'm really anxious, I love Epsom salt baths, which are actually magnesium salts. So, 1 or 2 cups of Epsom salts in a very hot bath, soak for 30 to 45 minutes. One of my favorite hacks of all time. There are other biofeedback devices I like as well. And you can seek out practitioners who do these. One I use in my practice for years is called Neuroptimal. There's another company with something called New Calm, and then there are like binaural beats that you can get on your app store, like I Awake. It's a very good company that has a good platform. And then if nothing else is working, I live here in Northern California, and I follow the work of Wim Hof. I don't know if you know him at all, but cold water will calm. If nothing else works, jumping in frigid cold ocean water, it really shifts that nervous system again to that parasympathetic state. Sounds shocking. You are shocked. I am shocked for 30 seconds or so. And every time I do it, I'm like, oh, I don't want to get it so cold. And then every time I get out, I'm like, oh, I'm so glad I did it. So, and if you don't live near the ocean, you can take cold showers. And I encourage, people to look at the research of Wim Hof. He also has some unique breath work practices. He has proven, one of the things I really like about him, he has proven in university settings that he can control his autonomic nervous system consciously. What we were told was impossible, this autonomic nervous system, he can control it with his consciousness. And that's inspired me to learn more about how to do this and to help teach this and spread the word.
How do you spell his last name?
His first name is W-I-M and last name H-O-F.
Okay.
Yeah, so they studied him at American med schools. He one of his famous things, he can get in a tub of ice water and not change his heart rate at all, or his temperature. His core temperature and heart rate stay the same.
That's wild.
Modern physiology, that is, we don't have an explanation for how he can do that. Yeah.
Wow, that is really impressive.
Right. So yeah, I love reading inspiring people who inspire me to push beyond the boundaries of what we define as normal and human, to evolve to a greater level of awareness, a greater level of health and ease.
Dr. Camp, I really want to thank you. I mean, actually, it's been enlightening and such an important talk and topic. And also just the herbal preparation that you've made too is actually really intriguing. And I know it probably was not an easy thing. It wasn't something you just stumbled upon. It was something that is your lifelong passion. And unfortunately, I've had to suffer with anxiety. So that's why I'm really especially interested in learning about it and trying it myself. But most importantly, thank you for your time today and sharing it with us.
Thank you for having me. I'm really, really grateful for the opportunity, and grateful to the possibility to connect with our listeners and to share some good information that I think is so important now to help so many people. So thank you so much.
Okay. Take care.
Thank you.